What we're going to talk about here are joint mobilizations. When you have a joint restriction or a joint is not moving well enough, we call it hypomobile. This could happen anywhere in the body. I could have a joint in my finger. That's a joint right there. That's not moving well. It could be stiff. Okay. I could have a joint in my spine. Let's say it's in my neck. That's called a facet joint. That could get stiff and not move well. Doesn't matter where it is. If it gets stiff and is not moving well, you will not be able to move like you want to move. In addition, that could create other pain. Maybe the muscle starts pulling a little bit too hard. Then you start to get an abnormal firing pattern, and then the list goes on. So what we want to do when we do an evaluation is we figure out which joints are moving well or not well. Sometimes they could be moving too much rather than not enough. We want to make sure that it's indicated that you do need your joint moving better before we do any intervention. So assessment is first, then we go into treatment. So the treatment for a joint mobilization varies as well based on the individual. Some people need a lot more aggressive mobilization because it's very, very stiff. Some people need just a little bit in order to get it from moving, it's a little restricted, to moving enough. And then we teach movement patterns to support that new range of motion that's gained. So overall, joint mobilizations mean that it's getting a joint that is stiff because we've assessed for sure that it is stiff, and that's the cause of the restriction. And so getting in there, getting that joint moving better. None of these are standalone treatments. After you get that joint moving, you've got to then teach the body how to use that new movement and how to not use any bad habits anymore. So it still needs to be comprehensive, but it's important to be able to understand that this is part of the treatment plan. And hopefully you found this helpful.